When you're dealing with a medical diagnosis with the brain or the spine, having the right diagnostic tools to know what's really going on is so important.
At Uconn Health, everything is under one roof at the Brain and Spine Institute.
Yes, we're speaking with Dr. Leo Wolansky, is the Chief of Radiology at Uconn Health. Doctor, thanks for being with us.
Thank you very much for having me.
Can you talk to us about what the purpose of the Brain and Spine Institute is?
Absolutely. So conditions of the brain and spine are extremely debilitating. People can develop, a stroke. They can have aphasia. They can become paralyzed. People can have headaches. They can have very bad backaches, things like that. And we have a great group of experts who, because of Uconn being a small institution, we know each other really well and we work very well together. So it makes a very streamlined experience for the patients, and that actually results in much better, more efficient care.
Yeah, I've done so many stories on strokes and other brain issues, and you'll hear this from doctors all the time, that time is brain. So how does Uconn work in such a special way to really make sure that the patient is getting what they need quickly?
Right, good question. So because Uconn, again, is because we're the right size, we're not unwieldy. So when a patient comes in with a stroke, the emergency room physicians immediately know who to contact. They will immediately reach out to the CT technologist, and the CT technologist, because we're so small, really, we're just the right size, they're able to reach us, the radiologist who's covering. The radiologist will be able to read the scan very quickly, and immediately I'll be able to send a message to the stroke neurologist and the emergency providers to let them know if it's a stroke that has a hemorrhage associated with it, which you treat one way, or if it's a stroke that has no hemorrhage associated with it, which you treat diametrically opposed in fashion.
Yep.
So if a patient has too much blood, you could say, if they have a ruptured vessel or something like that, you have to potentially close up the vessel that's bleeding. If the patient has what's known as an ischemic stroke, basically they don't have enough blood going to the brain. So they need to potentially open up the artery that's clamped down. And so we'll read the scans immediately. We'll notify the emergency room and the neurologist. Again, because of our small size, we're very efficient about this. And then they'll be able to start the TPA, which is a very, very powerful blood thinner that can open up the arteries that are closed down. And then we will then do a CT angiogram where we look to see whether a large vessel is blocked up or whether it's a small vessel that's blocked up. If it's a large vessel,
right,
that usually means that a lot of brain is at risk, and we can actually send somebody in, an expert, an endovascular neurosurgeon, Dr. Kethan Balsara, or our interventional neuroradiologist, Abner Gershon. They'll go in with a catheter and they'll actually pull out the clot out of the artery. And what you'll see sometimes is a spectacular recovery of a patient. Patient can be, aphasic, unable to speak, hemiparetic, half of their body is paralyzed. The clot comes out, and all of a sudden they're restored perfectly to normal. It's really remarkable.
That's really
and
amazing.
It really takes a very concise kind of efficient operation to be able to pull that off.
Yeah, when we talk about Uconn, just so the general public out there, if you didn't know this exists, what types of things could you go to, even for a non-emergency situation? Who should come see you?
Sure. So obviously the Brain and Spine Institute has to do with all sorts of neurologic conditions or conditions that cause pain that has to do with the brain or spine. So obviously we will deal with something as commonplace as headaches. We'll deal with things that are much more rare, fortunately, such as brain tumors. We have an excellent brain tumor program. Dr. Kevin Becker is a neuro-oncologist that recently was hired from Yale, and he runs this wonderful tumor board where all the experts gather and we discuss the patient in great detail. So I will show the scans of the patient, the MRI and the CT scan. I'll explain what the scans are showing what kind of a brain tumor it is. And then Dr. Wu, the neuropathologist, will talk about what the cells look like after the tumor has been removed. Dr. Bolsara, the neurosurgeon, will talk about how he removed the tumor, what he thinks, whether he got all of the tumor, which is fortunately usually the case. It's called a gross total resection. Wow. And then we will discuss with the radiation oncologist whether to give radiation for this tumor. And we also have a very close relationship with the JAX lab where they do genomic analysis. So brain tumors are basically new mutations.
Doctor, unfortunately, we're out of time, but we want to thank you so much for being with us. It was great to have you.
Oh, it was wonderful to be here. Thank you so much.
Have a great day.
For more information, you can visit health.uconn.edu.